work for the NHS. You've had a great idea, you've made it happen, and it's made a big difference to how we can learn from COVID-19 and enter a new normal. Ideas like yours drive improvement and they deserve to be shared. That's what BOB does. Amplifying good ideas like yours across the NHS so as many people as possible can learn from, adapt and implement your idea. The further good ideas are shared by the BOB community who learn from them, the greater improvement we can achieve. You made a change. Share your solution with others. Speak to BOB.
Very excited for this session, and it builds off the last one perfectly, because we're talking today about the theory behind spread and scale, and in particular, what are those human behaviours or those human factors that the system can learn from. And I'm joined today by a very experienced, esteemed panel to discuss this. I'm going to let everyone introduce themselves in a moment, but just to say we have Siri Steinmo on the line, who's Health Intervention Design Quality Improvement at the Health Informatics project at UCLH. We have Christina Jackson, who's partner at Sprouts Behaviour Change. Dr. Kathrin Cresswell, who's Senior Lecturer at the Usher Institute, University of Edinburgh. And Talia Moretti, who's a digital sociologist from Goldsmiths, University of London. And me, if you have seen me already today, I'm Marc Southern, one of the co-founders of BOB.health. What we're going to do today, first thing we're going to do is there will be a poll that will appear. If it's not there already, it should be there shortly. And the poll itself is just to get a bit of an understanding from your organisation, whether you work in the NHS or in any other organisation. What we'd love to understand is, in your organisation, what are the most important human factors that you think affect the spread of information, projects, or ideas? And so that is now in the polls. You should be able to see that if you click on the poll button. Add your details, and we'll come back to that later on in the session. So before we go any further, I'm going to turn it over to our speakers for them to tell them a little bit more about themselves. So if I may, Siri, if I may come to you first, if you could just tell everyone a little bit more about yourself, please.
Sure. Hi, everyone. I'm Siri Steinmo. I am a quality improvement professional and have a background in behavioral science and health psychology. I work for UCLH Health Informatics project, which is an intensive care. I'm currently working there. I've worked in a lot of different sort of hospital areas, and my main work centers around designing behaviour change interventions or quality improvement projects for the NHS.
Thanks, Siri. And if we can come to you next, Lisa.
Hi, everyone. My name is Talia Moretti. I'm a digital sociologist. I'm an associate lecturer at Goldsmiths. I do a lot of work within the private sector, but currently I'm doing a lot of work at the moment within government. So I'm at the Ministry of Justice working on lasting powers of attorney.
Thank you. And then Christina, over to you, please.
Hi, everybody. I'm Christina Jackson. I'm a psychologist and I specialise in behaviour change of clinicians and people with long-term conditions. I've previously worked for King's Health Partners, setting up the Centre for Adherence Research and Education, which had a remit of training healthcare professionals and disseminating adherence research. But mostly I've worked in industry for pharmaceutical companies, mostly on the development of patient support programs globally and locally. And I'm a founder of Sprout Behaviour Change, or Sprout Health Solutions, as we are since Monday. So it's only 2 days. So there we go.
Thank you, Christina. And yes, yeah, I remember that. Sorry, my bad. I should have done that. And last but not least, if we can come to you, Kathrin.
Yeah, hi. Thanks for inviting me. I'm Kathrin Cresswell. I work at the University of Edinburgh as a social scientist, and I evaluate large-scale, complex health systems changes driven by digital technologies. And I look at technological, social, organizational dimensions associated with that change. So I look at unintended consequences and organizational strategies, impact on work practices and relationships with vendors and policymakers. And I also teach technology strategy at the NHS Digital Academy.
Fantastic, thank you. So really looking forward to getting into today's session. There's one quick bit I just wanted to cover off first. People listening in and want to interact on social media. There's a couple of hashtags. We've got the giant hashtag, giant 2020, and there's also a hashtag specifically for this track, which is unpack the how. And if you want to mention us, we're at BOB.health, which is BOB.health. Great. So without further ado, I'm just going to go straight into the session. And I think this is a really fascinating session. And for us at BOB, I've kind of found a new understanding around psychology and certainly behaviour change since starting with BOB. And the reason behind that was because the very first thing we did before we built our platform was to really go and have many conversations with actually people in the NHS that they're experiencing challenges around finding information relating to other people's projects that they want to learn from before they start their own, or they've done their own project and they want to share that information out with others and they're just either not sure how to do it, best way to do it, or there's some other challenges there. So when we were having those conversations, and we had about 100 of these conversations in the first year or so, we realised there was something going on here that was a human factor. There was definitely a behavioural human factor that was at play. And so we commissioned some work actually with Siri on this panel to look into that in more detail. So we conducted interviews with various folk across the NHS, and from there we realised there were a number of different themes that were coming out loud and clear. And for us, it was really quite interesting to delve into those in a little bit more detail and work on how do we make sure we address those within our platform, BOB. So there were about 15 themes. So what we thought would be interesting today was to look at some of these themes in a bit more detail, because we believe that these themes really have an impact upon how people might be seeking information, searching for information about projects they might be embarking upon, but also how people share and disseminate projects and why things happen and why other things don't happen. So what we'll do is we'll cover off each of these things, and we'll go around each member of the panel and let them give their view on some of these areas, maybe what they've seen from their experience and what they think might change going forward in some of these areas, and what might need to be addressed. So the first thing, the first theme that we saw that I'd like you to react to is this belief that belief about consequences. And what I mean by that is what we heard when we were talking with various folk across the NHS was that if you've done your project and maybe you're looking to share it out there to the world, there was almost a spectrum, if you will, of responses you got. On one end, you got, what's the point? It's futile. There's no point in doing this. What difference does it make to the system? And then on the other side, you had, I guess you could call it, being overwhelmed. And that was where someone might have shared information about their project. They put it out there, it's online, their email address was on there, and maybe they are actually inundated with requests for information. And they kind of became this poster boy, poster girl for that change. And as a result of that, they were so overwhelmed that actually, I wouldn't say they regretted putting it up there, but there was certainly, it was a new challenge they had. They were being overwhelmed. So it's quite broad ranging. And it certainly was a big theme that came out in the research we did. And I'm just putting it out to the panel there in terms of what or whether you've experienced any of those, whether you've experienced that particular theme in any work you've done, and maybe you could elaborate more on that. And maybe if I may start with Siri, actually, because I know Siri, you were you were involved in that initial research, and maybe you could share the initial points. Thank you.
Sure. So so this was about kind of what people believed was going to happen if they shared some of their work, specifically about the sharing behavior rather than the sort of seeking behavior I think we're talking about now. So yes, this obviously, if you think that something good is going to happen from your sharing, you're going to be more likely to share and spread and scale. If you think something bad is going to happen, you're going to be less likely to share. So that's sort of very simply kind of what we were exploring there. And yes, Marc's right that on one side of the kind of spectrum, one end of the spectrum, we had people saying, when I share, or when I share at a conference, or when I maybe even publish a paper, nothing ever comes of it. No good is ever done by it, and it's so much effort, and it's a bit of a futile exercise. And on the other side, well, when I share, perhaps everybody's now going to come to me and ask me about my experience of working on this project, and I don't have the time for that. There's also another piece which I think's really interesting, and this sort of idea that we're sort of airing our dirty laundry. So once I share and once I put my work out to the world, will it be scrutinized? What would the unintended consequences of that be that maybe I'm not quite ready for? So those are just a couple of thoughts on that. What do I really believe is going to happen if I share?
That's it. And maybe, can I go to you, Kathrin, next?
Yes, of course. Actually, this resonates with the work we've done. So we're evaluating the Global Digital Exemplar program at the moment, which is about to finish. And actually, we looked at how that program has helped to set up a sharing economy across the NHS. And so we found that people will share, quite simply, if the benefits of sharing outweigh the costs of sharing. Now, obviously, that's influenced by what Siri mentioned, the kind of beliefs of what the benefits and costs are. But the problem is that they're very hard to anticipate in advance what you will get in return, and people can't manage what people will get out in return. So it's kind of an organic development that is difficult to manage from the top. And yes, we found exactly what you've just said, that certain types of knowledge and certain locations are actually were in higher demand than others, namely the digitized hospitals that had already implemented a technology, and loads of other hospitals wanted to learn from them. Now, and that created a kind of unevenness between efforts and returns, and where we had a lot of knowledge givers and a few knowledge givers and a lot of knowledge receivers. So and that's still a problem going forward, because we still have only few GDEs, global digital exemplars, and many hospitals that want to learn from them and need to learn from them, and that we're looking at how that kind of digital divide can be addressed. So yeah, have a look at our publications, but I'm very happy to share any more insights.
Excellent. And if I can go to you, Christina, to give your view.
Sure, thanks. Yeah, it's a really interesting topic, thinking about how our perceptions influence our behaviour, whether or not those perceptions are anchored in facts. And certainly Siri's research is backed up by, a lot of research that's happened in health psychology. There's a systematic review that shows that clinicians' perceptions of, their attitudes towards a behaviour, how far they think they can control, performing that behaviour, what they think other people think about behaviour, is a good predictor of how people behave. So this is certainly not an uncommon finding. And I think, moving into that idea of sharing the dirty details, I think that's the kind of thing that it's, depending on your organizational culture, it's easier to share internally. So, for example, for us as a company, through a whole project, we'll share how it's going, what could be improved, and it means you've got a constant opportunity to improve your processes and communicate that across the business. I think sharing externally, when you have, when there have been setbacks or hurdles, I think that is very challenging for people. I mean, as we all know, it's hard to talk about times when you have failed. And I think, there's a really interesting field of research. If you look up Carol Dweck's research around mindset, looking at whether people have kind of a fixed mindset or a growth mindset and how that might impact your behavior. So if you've got a fixed kind of mindset, then you would think that attributes like intelligence or success are kind of fixed. And so therefore, when you fail, it's a personal reflection of you not being good enough. People with a growth mindset are more likely to think that those are, attributes that are developed over time. So when you fail, it just shows you're not there yet, and it's an opportunity to improve and grow. And organizations also have these kind of, like an organizational culture has that kind of mindset too. So if you work in an organization with a really fixed mindset, it's very difficult to share failures because you're going to get shot down for that. And then I think, you're talking about the positive aspects of sharing. I mean, certainly I've found in the work that we do that our customers are most keen to share when they see a benefit for themselves. Frequently in career terms, if it makes them look good to share. But as Kathrin alluded to, there's a lot in having the bandwidth to share, and there may be fewer people who have the knowledge that they can share than there are within an organization or externally who want to access the knowledge. And I think so. One of the things that we've done in projects is we've provided that extra bandwidth for people. We support people to do that, and I think having that as a work stream in a project is a really helpful way to go.
That's really interesting. I'm going to come back on that positive reinforcement piece in a moment, but you mentioned culture a lot, and actually it's a lovely segue into Lisa, because I know, Lisa, we've spoken in the past about culture and how important it is to some of these things. So maybe, Evan, if you could pick up specifically on that point relating to what we were saying about beliefs about consequences and how culture is important in that. Thank you.
Yeah, absolutely. So such a lovely kind of talking point around these dirty details and how, in innovation, one of the things that we have to really remember is that in order to innovate, we need to know what's gone right, but also what's gone wrong. And we need people to share what's gone wrong. And so Ken Robinson has talked so wonderfully about creativity in the workplace and creativity in schools. And he talks a lot about how as a society, we've come to actually stigmatize failure. And so people don't want to come forward and to talk about their failures because, as Kathrin mentioned, as Christina mentioned, it looks like it's on them, right? So there is, when you're talking about failure, there is also a negotiation that you're having to make with yourself about protecting your own reputation and protecting your own identity. And, in terms of a culture, how do we change this? Well, we need a new narrative around failure. How do we change this to talk about about celebrating somebody being courageous enough to take a step into the unknown? How do we celebrate somebody experimenting in a really creative way, as opposed to highlighting potentially what went wrong? We celebrate the kind of courage and bravery that it takes to do something new and to be a game changer. And that is how we can maybe within our organizations change this negative perception around failure and turn it into a learning opportunity. And therefore you change the kind of the environment, the atmosphere in which somebody is going to be stepping forward and sharing something that may not essentially have been what they had hoped would have been the outcome.
That's interesting. Kathrin, I think that's you wanting to make a point. Go ahead.
Yeah, sorry. feel like I'm in school. Absolutely agree. Maybe just to add on to that, so there's this kind of hindsight learning, and there's a proactive type of learning that we might want to distinguish. And our work has mainly been, you can do your own evaluations, and those evaluations of initiatives can actually identify what kind of risks you might anticipate and mitigate them actually early. So you need to evaluate whilst you are implementing a system, so you don't crash into a wall that might be right in front of you that you just can't see because you're concentrating so much on the evaluation and actually on the implementation. And actually, there are frameworks out there that can take organizations through that process. And I would encourage anyone to do, rather do a quick and dirty evaluation than no evaluation. And you can actually make a massive difference and not just learn in hindsight, but proactively.
Yeah, that's very interesting, actually. And certainly is something that we certainly considered when we were building Bob, as a way to ensure that you could build on a project over time. So it's never static one moment in time. You can add to it, you can continue adding to it. I want to go back, actually, to the earlier point Christina touched upon, which was the positive reinforcement piece we were talking about and how important that is. And it was also mentioned earlier about career progression and some other elements there that are positive in nature as a consequence of sharing, that could be quite helpful to support people to actually share their information with others, and ultimately leading to spread of these ideas. Does anyone else have any other experiences or thoughts around that they want to add?
There's a really interesting social theory which we talk about social proof. And that's when somebody's in a new situation, they look to the group around them to understand what are the kind of norms or behaviors that somebody is enacting. And then they follow those kinds of behaviors and to be able to engage in this new situation. And I think there is something about this, there's something about us, a group of influencers who establish a set of norms or behaviors, and that then go on to influence how others behave. And so you kind of are able to create this kind of positive reinforcement. The tricky thing is that first bit about trying to find this early group of influencers. And, Kathrin kind of mentioned it earlier, you often find this 80-20 split where 20% of the people are creating 80% of the informational content. And so, and you find this everywhere. You find this on social media platforms. You find this, in a lot of forums, on Wikipedia, etc. So for me, this kind of starts, I think, with when you're in a new situation. Who is going to set those early on norms, those early on behaviors, and then how do you seed that through within your community so that others can pick up on those behavioral cues and find them easy enough to adopt and therefore enact and manifest their own kinds of behavior, their own kinds of positive enforcement.
That's interesting. In our report, some of the things that people cited as kind of reasons, motivators, powerful motivators they felt that would help them share were things, it was reward and praise, and specifically around it might gain them or their team kind of personal organizational kudos, or it could be linked directly to an award, or it could be linked directly to some kind of career progression, whether that be, it's evidence for my appraisal, or it's CPD points, or it's something like that. Then if anyone else has got any thoughts on that, or what might work, what they've seen work elsewhere. Kathrin, please go ahead.
Sorry.
You're not at school.
So I think we need to look into motivations, and in that we need to look at barriers and facilitators for networking. So actually in our work, what we found looking at interorganizational networking in the NHS, I know it's very simplistic, but it's a bit of a roadmap to successful networking, or relatively successful networking. So if hospitals, for example, were located next to each other geographically, knowledge flows work better. If they had a shared culture and context, knowledge flowed better. If they were talking about similar technological functionality, knowledge flowed better. For example, if they had an underlying similar electronic health record system. If they were both talking Cerner, then knowledge flowed more quickly and more smoothly. If there were regional and strategic alignments, for example, if they were located in the same integrated care system, it would work better. If professional agendas were driving a certain networking activity, for example, pharmacists have been hugely successful in sharing knowledge around the implementation of electronic prescribing systems. So these are the kind of like pointers that can help you set up relatively successful knowledge flows. Barriers, so competition around prestige and resources, history of deployments and concerns of what Christina has already alluded to, concerns of failure and repeated failure and damage to reputation, variations in technological systems, which means that it sometimes wasn't applicable, a certain type of change, and different cultures and patient populations and needs. So, yeah.
Yeah, it's interesting. Does anyone else have any other points to add to that?
Yeah. Oh.
Go ahead. Go ahead, Christina.
No, I was wondering, Kathrin, do you think like part of the reason for that, that it's easier to share, for knowledge to flow through some environments than others, is that partly about having sort of like a shared language that people already have to understand things, that, as you go further afield in terms of like disciplines, not just geographically, that it gets harder and harder? Because it's certainly something that I have experienced in my career working in multidisciplinary teams, is that the further away you are in terms of your background understanding, the longer it takes to get to a point where everybody actually gets what the other person is saying, because we have just totally different frameworks for understanding things, I think.
Yeah, definitely. I absolutely agree. I mean, that's the whole problem in health technology change, that there's still a bit of a disconnect. I was just in a session from the Digital Academy this morning. There's a disconnect between IT and clinicians, and they often, people were telling me they went out for dinner and they couldn't actually have a conversation because they were that different. But if a chief information officer knows another chief information officer, even if it's in Edinburgh and London, they exchange experiences. They speak the same language. It's much easier. Yeah.
Siri, go ahead.
I just a little note on that. I work in an informatics team as sort of the only non-informatics person, and I often feel like people are speaking another language in a meeting that I'm sitting in, and actually we're all working toward the same aim, but finding a common language is very difficult sometimes between not only myself as a sort of QI psychology person, but doctors and software engineers and people like me all speaking the same language, even though they're all working toward the same outcomes. Very difficult. But I wanted to say something about Kathrin, what you were saying about the simple fact that hospitals that were in close proximity toward each other had more of a sharing culture going on between one another. I've seen this this week in the intensive care unit that I work in. I saw a great presentation yesterday of some junior doctors who'd done some work around sedation of COVID patients and what our sedation practices were like in the first wave of COVID. And I sat in this meeting yesterday going, have they talked to the nurses? Because the senior nurses are doing a sedation project on the same unit, on the same intensive care unit. And it occurred to me that there aren't opportunities now with social distancing for the senior nurses and this group of doctors to ever be in the same room. And they're not invited to the same meetings anymore because we actually can't be in meeting rooms with one another. And where there would have, I think that this is actually a real factor in why they hadn't shared with one another or known about each other's work, that they actually physically hadn't seen each other since the beginning of the pandemic. There are, of course, other reasons. I mean, the nurses and the doctors do tend to work independently anyway in intensive care, and they really do have very different roles with critically ill patients. But I thought that was what you said about the sort of proximity really made me think of that, and how, wow, just something as simple as having the opportunity to physically speak to one another had affected that. And I had to bring those two groups together and say, I think you guys have some data for each other and some information for each other. So
that's really interesting. I wondered, because the other theme that came out was around professional role and identity. I think we're touching upon that now there, and there was this perceived hierarchy of also who had permission to share, and it was thought that, you know, for some bands and roles it was not for them to do, even though actually they were heavily involved in the project, or others thought just it wasn't acceptable for them to be doing it at all. And so, and then the final thing was, I think we've touched on this, is actually this competition piece as well, competition between different trusts, different teams, different individuals. And I wonder if anyone else has got any other thoughts around that. Lisa, go ahead.
I don't have so not so much around the competition piece, but around this when it comes to working in multidisciplinary teams. I think one of the struggles that we really have found is that there are often very few people who work at the edge of both disciplines, and so as a result you never have this person, which, you know, for lack of a better word, a bridge person that is able to bridge the gap between two different teams, to be able to say, when they say this, what they mean in your language is this. And it's a bit of a translator role. And I think this lack of, we just haven't professionalized these kind of bridge people yet within multidisciplinary teams. But I do think that it is such a key role, this professional facilitator, this professional translator who's able to bridge these two gaps, in order to get more sharing to take place, and more sharing to be communicated both within the team itself, but actually as well as externally. You know, that person can also be a bridge between the team and an external type of audience. But I think that lack of professionalization around a networker role or a facilitator role is actually hindering a lot of sharing from actually taking place.
That's interesting. Kathrin, go ahead.
Yes, I agree. We call them intermediaries in social science, or like you say, Lisa, translators and connectors. So people who help to translate and build relationships. And we found actually that the problem is that these people are not in the place they are in because they've been put there, but because of the people they are, if that makes sense, because of their attitudes, because of their interpersonal skills, because they're just placed in a way that helps them connect others. So, for example, we found that vendors, actually, software vendors played quite a big role in user groups, and, you know, putting users of different organizations together to discuss a specific software problem. Or, like I mentioned, the pharmacists, they didn't want to be there. Nobody's put them there, but actually they had a common aim, a common purpose, and common benefits out of getting together and translating between IT and pharmacist as a profession. Now, the problem is, how do we then establish these roles? I think we probably need to identify these people and enable them in a way as strategic decision makers. How? I have no idea.
It's interesting. I just want to say that we just got a comment through from one of our participants, and they were saying, great points. How about providing better guidance for entrepreneurs on connecting with individual innovators within the NHS? Those with great ideas and insights. We also need more of a heads up about upcoming core NHS innovations and emerging standards. So again, from the other side, that bridge piece as well, from an entrepreneur SME perspective into the NHS, you know, more understanding there about what's happening and what's coming online as well. So that is definitely interesting. Just following up some of those points there around that intermediary, the professional role, there was another theme as well, which is, again, a slight build on what you've already said, which is the role of facilitators of networks. Right? how do you actually sustain a network, whether it be informal or formal over time? Because I guess that's what we're talking about here, really, is we're talking about these groups of people that surround each of these challenges, each of these problems, and ideally that they're all sharing and they're all talking. But how are these sustained? Has anyone got any thoughts on that?
I think.
Go ahead. Oh, Christina, if we can come to you. Thank you.
And I was just going to say that in my experience in, working with pharmaceutical companies, the networks that I have seen that, really work well at sharing knowledge and are sustained over time, there's an intermediary, using Kathrin's terminology. The intermediary is a person who absolutely needs that network to function in order for them to do their job. So we find, it might be an individual working for the global team in a pharmaceutical company who needs to involve local markets to roll out strategies or materials or whatever, and they need to share knowledge. They need to understand what's going on in those local markets, and they need to get their buy-in in order that any of the work that they do at a global level ever gets rolled out. And so I think, in terms of being an intermediary, I think having that job exist is recognizing that it's a thing and that it's a job that exists is a really important step. But there's also, there's got to be the motivation for the intermediary to care about, about performing in that role. And yes, as I say, usually it's because there's something very much at stake for the individual that makes them a very effective intermediary.
Yeah, that makes a lot of sense. And I don't know if anyone else has got any other views on that. Lisa, go ahead.
Christina just took the words straight out of my mouth. I think the most important thing, if you want to sustain a network, sustain a community, you have to make it somebody's job. You have to say you are accountable for doing this. You have to recognize this as an actual role. And, I think what tends to sometimes happen in teams is that there's a few people who are expected to fulfill multiple different roles and responsibilities, and it's just not possible when you are doing the job then to be able to say, oh, now you also have to be a facilitator, and you have to be a sharer, and you have to go to these conferences. It's a huge amount. So he doesn't maybe want to be able to put themselves forward for all of those different reasons we've already spoken about and do that. But also it's a whole person's job thinking about who is the audience? How do I tailor the story? What is the communication style? What is the tone? There's a whole communication professionals have been working in this area for a long time, thinking about some of the nuance around narrative and storytelling, and how do you kind of share at the right level to the right audience. So for me, it's definitely about seeing this as an actual job of value, creating this position within the organization, and then empowering that person to be able to actually create the narratives and make those connections, and making it easy for them, not to put loads of barriers and say, oh, you can't talk to this person, you can't talk to this person. You have to facilitate their role so that they can move through an organization and through the world to be able to share.
Mm-hmm. And there's something actually that I know Siri and I have had a discussion about this in the past, around regret for not sharing your work. And I think we mentioned it right up top here, that the consequences, you don't always know the consequences when you're doing the project. They're in the future, so you can't see them. But certainly regret was something that we had heard. And I know there are some examples from across the system where people have said they wish they had shared something in the past, because 2-3 years down the line, they wish they had, because, it could have really helped in X situation. And I don't know if anyone can talk there. I don't know, Siri, if you're able to, maybe not the exact stories, but maybe you can talk a little bit about regret, and then I'd love to hear everyone else's views on regret and what part that might have to play in some of these things. Go ahead, Siri.
Specifically, I've been involved in a project that I think everyone that was involved now regrets that it wasn't shared, and that it sort of the how-to of the project hadn't been disseminated, because actually the results of the project were very good and really meaningful. It was in neonatal intensive care, so it's sort of this area of medicine that is quite evocative and incredibly important. And people worked extremely hard on this project, and we saw admissions to the neonatal intensive care reduce significantly. And that work never went anywhere, and nothing was ever published. And it's not really about, I think the regret isn't really about kind of kudos or notoriety. The regret is more about those how-tos and the interventions and what was actually done and not being passed on. So yeah, I can personally say that I've been part of a project that didn't get shared that absolutely should have. And I think the main reason, coming back to Lisa's point and Kathrin's point before that, I think it was Christina's point before that, was that it was nobody's job. Nobody had the time. Nobody who was working in that team of midwives and neonatologists had the time to think outside of this organization right now and the impact that we're making, or this unit, actually, this neonatal unit right now and the impact that we're making, and the doing of the intervention and the planning and the doing of the intervention. And that is because in the NHS, we have a major problem with sort of seeing innovation and sharing as an aside to normal business, and everybody is going to just stick it into their normal day job, which is already incredibly taxing, and you already have more things to do in your day than you actually have time for. And then to sort of tack that on as a like, oh, in your own time, why don't you just, come up with some amazing ideas, design and implement an intervention, and then disseminate it to the wider world. It just doesn't happen. We've got a major problem with that in the NHS, that those roles don't exist in the main, and that the sort of world of innovation and sharing is woefully under-resourced.
Thanks for that, Siri. Thanks for sharing your personal story. Does anyone else have any other thoughts around regrets? And Kathrin, yeah, go ahead.
Yes, I agree. It takes time to share knowledge, and it takes time and resources to share knowledge, and it takes time and resources to curate knowledge. And I think because we are so busy, which makes absolute sense. We're so busy providing care. It's always an afterthought, this kind of thing. But it must not be, because it's too dangerous for it to be. It's quite difficult to say how dangerous it actually is, because in hindsight we don't know, what would have happened if we wouldn't have done it. But it's a duty that we have to share and curate knowledge. And the problem is also, we found in our work that clinicians take that role for a while, but then they will always revert back to being a clinician. So there's, like people, like everybody has said here, I suppose there's the need to establish clear kind of career pathways for these kind of people, and allow them to take time away from their clinical work, because clinicians can be very effective in doing that kind of thing, actually. But it's hard work.
Yeah, that's interesting. Very interesting. I just quickly want to go back through just the poll results we've had back there. So the most important human factors that people mentioned, there were three. Actually, it was a three-way tie, and not surprising because we've kind of had these conversations between ourselves here. So geographical proximity was one. It was a kind of three-way tie. So geographical proximity, informal networks, and having a similar professional background seem to be the top three. Factors that people believe are most important there in terms of sharing and spreading information and ideas. So maybe no surprise there. I don't know if any reflections there from the panel on that at all.
I wonder if kind of this new more digital, more virtual world that we're living in. I mean, we're all sitting here on a virtual conference rather than a conference in real life, is an opportunity to kind of break down some of those barriers about proximity. We've certainly seen in quality improvement, we've seen an uptake in people accessing courses and getting involved in projects virtually in many organizations now versus before, when you actually had to kind of rock up to a away day in real life and do a quality improvement day course. You're actually seeing the organizations I've been in contact with about this, seeing more people kind of accessing that because it is virtual. So I wonder if that can help.
Just to say, by the way, we are coming up to the end of the session. We can actually overrun a little bit. So I don't know if all the panelists are okay for a few more minutes. We can stay on the line. Super. I just want to go back. We had a couple of audience questions. One of them was about just to all of you, if you the question was, what's the bravest share that each of you have undertaken yourselves or for an organisation? Who wants to take that one? Lots of pondering and thinking there. You're going to go. Okay, go ahead.
I worked on a project in 2019 on oxygenation practices in the intensive care unit. And the first time that I presented to the board, I won't go into the details, but I presented the data. I had completely messed up the data analysis. And I presented this like completely wrong graph to the senior staff of the ICU. And as I was presenting it, realized as well. So I kind of had to actually bravely, I guess, share that, sorry, this is actually incorrect. And what I'm saying to you right now is incorrect. Can I come back to you? And I had to come back to the senior staff meeting a month later and say, and here's the real analysis. So there you go.
Brilliant. Well, thanks for your honesty. Christina.
Yeah, I have a tendency to probably overshare my failings. My business partner would say. And I think, you know, as Siri's just alluded to, it's painful because it makes you wonder whether you are now diminished in the eyes of the person that you've just shared with. So I was telling somebody new that I'm working with the other day about they were proposing to use this particular process to do something, and I was like, oh, brilliant, that's really good, because I've found that if we do it this way, if you make a small error, then it can have really big ramifications, because I've done that before and I've made a small error and then it's been really bad. Whereas this way we can see more what we're doing. So it was useful because I've learned that through experience. And so I know that this way of doing it is a good way to do it. But it does make you wonder, is that person that I'm working with now, have I undermined their confidence in me because I have admitted that in the past I am a human being and I have made mistakes, you know, and I've learned from those mistakes. So yeah, I think sharing can be a bit painful. Yeah, it takes
Thank you again. Thank you for your honesty there. And over to Lisa, and then we'll come to you, Kathrin, after. Thank you.
I think my most painful share was when I was doing some consumer research for a very big fashion retailer, and they had spent a lot of money on a global campaign, and they were asking me to do some research about what people thought about the campaign. And essentially what I found was that the campaign was a total failure and people hated it, and that they didn't trust it. It made them really suspicious of the brand. It made them really concerned about what the brand was the messaging and some of the values that the brand was communicating. And I had to present the findings to the executive board and the CEO. And I was so afraid to tell them what I'd found, because I just thought, I am really concerned. I was a freelancer researcher. I'm not going to lose my job, but I feel like I'm going to get somebody else into trouble. And I feel like I really hope that no one gets fired over this. And yeah, and that was a very, very scary thing to do. And they took it very well. But that was my bravest share, or the time when I was sharing and I was most terrified of the consequences.
Thanks, Lisa. And over to you, Kathrin.
Actually, I mean, at work you always try not to, but my kids, yeah, I have learned, and it's been very hard, that you can apologize to your children if you've made a mistake. But you know, if we still live in a society where we believe, and I believe this, and I think a lot of people do, where people believe they shouldn't be apologizing to their kids if they've done something wrong because they look like a bad parent, or you know, somebody that you can't look up to, then you know, we need to think about it. Yeah, if we can't do it in the home, how are we expected to do it in the work? So I've learned that the hard way. I do apologize to my kids now, and I've shouted at them again. So.
I do the same. Thank you so much, everyone. That's been really interesting. And then we're going to have to draw a line on the session in a moment because we've overrun a little bit. But I just want to say thank you ever so much to each of you for your contributions today. It's been really interesting. Again, as I said yesterday on the session I was running, we could have done this for an hour and a half and still continue talking about these areas. It's really fascinating. And as I said right up front, at the beginning of BOB for me, I didn't know anything really about behavioural change. And I'm learning every day, and it's fascinating. It really is, and it really is such an important aspect. The human being is such an important aspect of any kind of adoption, whether it be technology or anything. It really is super important. It should not be overlooked. And I think just to summarise some of the interesting things we've had today is that culture is really important in this. Don't overlook it. Failure is okay. It's okay to share, as scary as it might be. It's okay to be brave, or it's good to be brave, but I know that might be scary for some people. And the final piece is around, you know, professional roles and responsibilities as well. It's okay for people to share if they're not the most senior person on the project. I mean, there are other things there, but those are certainly the things that resonated with me. So just leaves me to say thank you again for all your